Hips are collapsing and crawling, and there's a leg drag. Okay, what's going on? Now, I'm about medical. First one to suggest a doctor, as well as movement milestones. We need both. I don't like how the hips are collapsing. And I mentioned it in the comments because I apologize for my comments. My comments are like, I'm flying by the seat of my pants, meaning I am so busy. So when I type, it's like, I'm less impersonal. I don't mean it that way. People are used to the lives. So I'm sorry if it seems I'm abrupt. I'm not abrupt. It's just, I'm just getting my thoughts out. For if I were to sit there and type for 4 or 5 paragraphs, you'd still be saying, what? And this is why I do videos. So with that being said, I'm not happy how the hips go out. Yes, they will look for clicking and so forth like that. I don't care who you are. It's an x-ray. I'm not a doctor. It's got to be between you and your physician what you want to do. I'm not here to say yay or nay, but if you want to rule out hip dysplasia, also to have a baseline, the only way you're going to do that is with an x-ray. So that's your call. And that's a call to again, when you have services. I'm not a doctor. I'm not an orthopedist. I'm a movement specialist. But I don't like how they go to almost to a 90-degree angle. And I also don't like the way they slide out. In crawling, what you should be getting, and I have to do it this way on the rubber doll, so I apologize. So it's not that I can get a 4-point crawl and 2. But in crawling, what you're looking for is that ability to go behind the knee and over the knee, right? And so the knee itself here has to cross midline. Now, also the reason why I asked for vision at 7.5 months old with your child is still sporadic, meaning, and again, this goes back to the midline. Great visual evaluation that you're going from here to here, right? But what you should see is this, smooth. It's a follow, not a track. What you're getting is a midline gap, and then they're catching. And a gap here, and then he's catching. Right? So you're seeing the eye kind of do this. It's not getting smoother. So you can do it even at the high chair, dinner table, and so forth. Start working very slowly. You catch that vision and just start to move it. And what you're looking for, again, see how I'm just crossing midline with my eyes, right? I'm just crossing midline with my eyes. What you're not looking for is that I lost it, or I lost it, and catching it. You're seeing these jumps. It's not as smooth as it could be. Now, again, at 10.5 months to 12 months, then it's full-on tracking, and then the eyes will separate from the head. So in other words, I can keep my eyes still, my head still, my eyes, or my head moving and my eyes can stay in the same position. And that's what it is. A lot of people feel a baby can track at 3 months or 3 weeks. No, that's not how it works. But again, it's just different language. In Europe, especially like the Czech Republic or Russia, there's no 2 words that one word means follow and track. It's like it's the same word. And they always get perplexed when I'm teaching vision over there. So that's what you want to work on for the vision. Keep an eye on it. You might be having where we need to look at an ophthalmologist for that. But I don't like how those knees are sliding out because, again, see, I can cross visual midline. You're not getting, the knees should be crawling like this. It shouldn't be where I'm bringing my knee all the way back and then sort of sliding back, especially out to the side. So you have a right to be concerned. Where you're not going to get help, you've got a good-looking child. 2, you still have locomotion. 3, as far as they're concerned, crawling's not a milestone. Guys, you can clearly see by this that the quality is not there. The child's collapsing. And 4, they're going to say get stronger. It's not about strength. There's no midline crossing. There's no support of the knees. Babies aren't supposed to be that strong. And so you really want to do the crawling course and that all 4s to really and get that. And so we're successful. But what I'm looking for when you're working with that, and you can go over your child's leg or your leg with your child, but what you're looking for is, again, that ability to cross that midline, right, where that's at, just to show it here, right? So that knee is here. See how the knee crosses midline? This is not what I want for that leg to come out. And so that's where, and again, your child can be lying down sleeping, guys, you can work on the crawling course and do something like that. But that's what you want to work on is that, I'm going to spread my fingers so you can see it, is that knee crossing midline, not that leg falling out. And that's what your complaint is. But again, I cannot stress enough. Yes, we need to improve the quality of crawl, but we also need to know what structurally is going on. And it's, I think, really, if you're in this situation, if I have hip dysplasia, I can't be strong enough to prevent the fall. If you're falling, right, you'll never be strong enough to stop falling. It's there. And so when the hips are just giving out, the structure's not there, that's different than being strong good enough to crawl. Babies aren't strong, they use weight transfer, they do all of those kind of things. But I would start having that conversation to rule out, to make sure we're structurally good to go.